We have a brand new Social Security plan, a new bill that is actually backed by Bernie Sanders. Take a look at this. A new plan to address disastrous cuts, Social Security update. So this is the Keep Billionaires Out of Social Security Act. Have some new updates on this, as this is mainly proposed by Chuck Schumer, but there are a lot of other Democrats that are supporting this. I'm going to let you know the details on that. Also, we have another video clip from the hearing that happened with Social Security a few days ago. I'm going to play you that full video clip and give you some other important updates as well. Before I dive into the main content, if you appreciate these Social Security updates, hit the like button and subscribe to the channel for more Social Security updates. So, Social Security update, we got a new plan to address disastrous cuts. This is Bernie Sanders has backed it, saying that he introduced it here, but I thought it was introduced by Chuck Schumer. Anyways, it's called the Keep Billionaires Out of Social Security Act in an attempt to undo what a group of senators is calling disastrous cuts under the administration. Sanders, along with Senators Ron Wyden of Oregon, Chuck Schumer of New York, created a proposal as a way to counter President Trump's policy changes targeting the Social Security Administration. This legislation, unveiled for the 90th anniversary of President Franklin D. Roosevelt signing the Social Security Act into law, reverses the disastrous cuts the Trump administration has made to the Social Security Administration, Senator's office said in a statement. So more than 70 million Americans rely on Social Security, and nearly 40% of people over age 65 are estimated to be living in poverty if they went without government support program. The new bill's proposal arrives after the Trump administration cut more than 7,000 jobs from the SSA and closed field offices throughout the country. Under the Keep Billionaires Out of Social Security Act, Social Security office closures would be prohibited along with relocations and service reductions. Trump's layoffs would also be reversed, with funding to improve customer service increased by $5 billion. So throwing $5 billion to the SSA to help with customer service there. The law also calls to safeguard Americans' data and remove the Department of Government Efficiency, also known as DOGE, authority on the SSA. The proposal is to thwart the privatization of Social Security system as we know it. Sanders wants to increase funding for the system while also improving field offices rather than closing them down, according to Kevin Thompson. The new proposal being backed by Sanders, Ron Wyden, Schumer, Richard Blumenthal, Kirsten Gillibrand, Elizabeth Warren, Ed Mackey, Jack Reed, Sheldon Whitehouse, Andy Kim. So this whole thing is all Democrats. So this proposal is backed by all these Democrats. No Republicans here. So this is just strictly partisan Democrat-backed bill. In 2023, Social Security lifted 27.6 million Americans out of poverty, including more than 19.5 million seniors, according to Sanders. According to this, Sanders is essentially proposing to throw $5 billion more at customer service. That's not expanding benefits, that's fixing the plumbing. He's going after fixing the core inequality. Now, I'm all for fixing customer service, but $5 billion, that's a lot of money just for customer service. But let me know your thoughts on that, as I've played many, maybe if you check a few videos ago, I have the SSA Commissioner, Frank Bisignano, talking about how customer service is improving. Now, again, I'm not on Social Security, so I can't verify that. Really curious what your thoughts are on Social Security customer service at the moment. $5 billion just seems like a lot just for customer service, as opposed to throwing $5 billion to some type of increase in benefits, some type of enhancement of benefits. Just saying that. Let me know your thoughts on that. So that's pretty much it here. It goes through a couple of quotes. They said that the bill will probably, there's no votes in Congress. Excuse me. No votes in Congress yet. So yeah, I'll let you know what happens with that bill. Speaking of Congress, take a listen to this. This is coming from Judy Chu at a recent Social Security hearing. Take a listen to what she has to say about Social Security here.
Well, thank you. Now I'd like to recognize the Work and Welfare Subcommittee member, representative from California, Ms. Chu, for 5 minutes requesting.
Thank you, Mr. Chair. I want to set the record straight here. For all my Republican colleagues talk about wanting to support people with disabilities, the actions that they have do the opposite. Our nation's Social Security disability programs are a lifeline for disabled Americans, providing basic income for people with severe and long-lasting medical impairments. The eligibility requirements are strict, and the benefits are extremely modest, just $19,000 a year for those on SSDI and $9,000 a year for adults with disabilities on SSI. But year after year, the Trump administration and Republicans in Congress have tried to slash these modest benefits. Just to name a few, during his first administration, President Trump sought more than $70 billion in cuts in Social Security disability benefits, including plans to make it harder for older, severely disabled workers to qualify, to throw disabled people off benefits by subjecting them to more frequent paperwork reviews, and to cut retroactive benefits in half for newly eligible disabled workers. And then, over the past 3 fiscal years, the Republican Study Committee, representing more than 80% of House Republicans, has proposed a slew of harmful cuts to Social Security disability, like reducing benefits to the poverty level, time-limiting benefits, making it harder to qualify, and forcing disabled workers to wait 5 years for Medicare eligibility. And earlier this year, House Republicans included billions of dollars in cuts to SSI on their initial so-called menu of options for budget reconciliation in order to pay for tax cuts for billionaires. So if my Republican colleagues are interested in exploring ways to ensure that Social Security disability beneficiaries who are able to work can do so without losing their vital benefits or their health care, we stand ready to work with you, but not if the main motive in getting them to work is to kick vulnerable people off their benefits. And so, Ms. Groniger, I'm deeply alarmed by the collapse of Social Security's customer service under President Trump. His administration is taking a wrecking ball to the agency, forcing out more than 7,000 SSA workers, or about 1 in 8 employees. My office has been flooded with calls from constituents. They can't get through to SSA on the phones, they're facing long waits at field offices, and they're struggling to get any help from the agency at all. I heard from one constituent who said, I depend on my disability check to keep a roof over my head and food in my mouth, not just Social Security, but Medicare, Medicaid, and SNAP as well. They all keep me alive and healthy, not homeless and starving in the streets. This is literally a life and death issue for me. So, Ms. Groniger, how can the quality of SSA's overall customer service impact the effectiveness of a return-to-work strategy for people with disabilities?
I think you've really hit on something in that you must have the customer service as a base if you really want to give people the ability to go back to work. If you can't get information because you've been waiting on the phone for hours, you're not going to trust that you have access to your benefits if you work. Similarly, if you go to a field office and you're told that you have to make an appointment, but then you can't make an appointment and so you can't talk to a person, you're going through all these hoops, it's not going to make people feel as though they can try to work and still keep their benefits. And I think that's the kind of thing that we are worried about and that we've been hearing from advocates. You know, depending on where you are in the country, your experience with Social Security can vary greatly. It may take you an hour, it may take you 4 hours, but it's not good, and that shouldn't be anyone's experience, no matter where they live in this country, if we're trying to say that you can trust that Social Security is going to be there for you and help you if you want to work.
And also, I'm deeply disturbed about the potential use of AI in these complex and high-stakes determination of eligibility. Can you say something about that, the use of AI in Social Security disability determinations?
Sure. I think that AI can be a really useful tool, but it shouldn't be a replacement for experienced staff and people, and especially for seniors and people with disabilities. You have to make sure that you're giving them full access to the customer service that they need. And we all know that AI is not perfect. We cannot have people with disabilities and seniors as test subjects to try out AI. We have to make sure that we're using it properly and that it is serving our needs. The National Academy of Social Insurance actually put together a report around AI and emerging technology and disability specific to SSA. And they talked about the different guardrails and principles that are necessary when you're thinking about how to use AI. One of which is that we can't use AI to make decisions about denials. We can't have AI denying benefits. We need to have people who are looking at these applications, who are talking to people and engaging with people, and not just replace them with AI, because we're not going to be successful.
Thank you. I yield back.
Well, thank you. And I just want to mention that, this hearing's not about work requirements for individuals with disabilities. We shouldn't be framing it that way. I mean, disabled individuals have always been exempt from work requirements in federal programs, and that will continue to happen. We want to look forward to being able to talk about opportunities for folks that want to return to work and how they can do that, and kind of how do we get past this trap system that we're in now, making sure the federal programs aren't an obstacle to being in the way of work. So.
Hi, my name is Bill, and this is the tip of the day. Do you know what you should always know to do? Even though if you can't go travel or anything, you could always try to find something they could do in the area that you're at, or maybe you could probably go visit another state if you have a car or so, and you could go to different places, but it doesn't always have to be traveling to different countries and stuff. But oh my god, but whatever makes you happy, just do it. Bye.
There is a $1,400, that's $1,400 Social Security increase proposal on top of whatever else you're making, a catch-up payment. If you haven't heard about that in a while, I have an update on the $1,400 Social Security payment just for Social Security recipients in this video right over here. So click that video now, and I'll see you in that video. Take care, be safe. Thank you for watching.